Hello, my name is Taylor Unrein. I'm an MSOT student at Kaiser University. It was there that I was introduced to an 8-year-old with Williams syndrome. Williams syndrome is a genetic neurodevelopmental syndrome. This syndrome occurs due to the deletion of the 26th through 28th gene on the 7th chromosome. There are two DNA tests to determine if an individual has Williams syndrome, that is the FISH test and the microarray. Two occupational performance concerns would be difficulty with self-feeding and swallowing, and the poor muscle tone and muscle weakness that these individuals likely have. Two occupational performance strengths are the highly social personalities that these individuals have and how adaptive these individuals are. Some underlying factors and characteristics of the diagnosis that need to be addressed are the poor muscle tone and joint problems due to the hyperglycemia or high calcium levels in the blood, which is observed with low muscle tone and weakness. Another factor that needs to be addressed is the difficulty with swallowing and self-feeding. So creating a visual aid for self-feeding, utilizing sayings such as chew and swallow for that constant verbal reminder, training to assess adaptive equipment, such as thickened utensils for individuals with Williams syndrome. Another factor that needs to be addressed with this child is the hypersensitivity to sound. So coming up with strategies and techniques to cope with the sound issues is going to be beneficial, especially for the 8-year-old in this 8-year-old in the elementary school setting. An additional factor that needs to be addressed is the child's excessive communication and common presented ADHD qualities. Although this is definitely a positive in some setting, however, in the school setting, this may not be a good thing due to the distractibility of other classmates. Environmental modifications might need to occur in the classroom, such as placing the student near the instructor, away from other stimuli, or an a quiet environment, maybe even providing a fidget cube so that way they get that sensory stimulation, so that way they are not so outspoken. Identify two frames of reference that may be appropriate and why. I chose to talk about the developmental frame of reference and then also the sensory integration frame of reference. The developmental frame of reference focuses on the gross coordination, the social, the oral, emotional, cognitive skills throughout interventions. And the sensory integration focuses on the self-regulations due to the overstimulation of others, which is often presented with ADHD tendencies. Thank you so much for listening to me, and I look forward to implementing some interventions with this individual.